Breast cancer is one of the most common cancers that form in women, and yet it is surrounded by some of the biggest myths of how you get it and how you get rid of it. In this video, I debunk some of the myths that you probably have heard and even believe, and get to the truth about breast cancer.
You're watching the Dr. Jake podcast.
I'm Dr. Jake. I'm a naturopathic medical doctor and integrative physician in Salt Lake City, Utah. On this channel, I share with you how you can heal your body and get down to the root cause without any harmful drugs or surgery. Be sure to subscribe for more videos like this one. Okay, let's jump in. Have you heard about some of these myths regarding breast cancer? It's time to stop believing them. The first myth that I wanted to talk about today is diet does nothing to prevent or treat breast cancer. And that is just one of the biggest myths I ever hear. I'm sure many of you here that have cancer, have family with cancer, you have heard from your oncologist, medical oncologist, that diet doesn't do anything. You can eat whatever you want. It doesn't matter. Go out and eat a donut. You have cancer. We're going to be doing chemo and radiation. Might as well enjoy life by eating these foods. And that is so sad because I see patients believe in that and they're like, oh, finally, I don't need to follow a good diet. I have cancer, I was eating a good diet anyway, so now I'm just going to eat crap because I have cancer. And that's the worst thing you do. That's like throwing gasoline onto the fire when you do that. And I really don't know why oncologists like to say that. Maybe it's because they have very little understanding of diet and nutrition and the effects that it has on the body. But there's a lot of research to show that diet has good effects on treating cancer and also preventing cancer. We have a lot of research on that. We've tracked it, and we have even on oncology books looking at certain diets that you could follow that will make cancer worse. It's just a crazy thought to talk like that and say that you could eat whatever you want. Please, if you're listening to this, don't eat whatever you want. You need to follow the appropriate diet. In this episode, we're not going to dive into all the good foods. We have done this in other episodes, but diet has a huge effect on benefiting cancer and treating cancer and preventing it. Number 2 greatest myth regarding breast cancer is that soy is bad for breast cancer. I'm sure many of you have heard that. Maybe many of you are not eating soy because of it. Now, there are certain soys that I think will promote breast cancer, like GMO soy, which is 95% of soy, especially here in the United States. But the great thing about soy is it's high in phytoestrogens. And that was the first thing that was scary about soy or other phytoestrogens that foods that we have is there was a theory behind it. Okay, these look like estrogen, so they are going to be bad for estrogen positive breast cancers. But when we actually started doing research on it, we actually started seeing the opposite. We started seeing that there's better outcomes when we are eating soy than not. And if we were really being intelligent, we would look at other cultures that eat a ton of soy and see if they have a greater risk of breast cancer. That's a good way of looking at that. And we don't see that. Asian cultures do not have higher incidence of breast cancer than European countries or American countries. They actually have lower incidence and they eat a ton of soy. So soy is not going to give you breast cancer. Soy is not going to make your estrogen positive breast cancer worse. It's actually going to be beneficial. The reason why is it's going to dock itself. A little estrogen, phytoestrogen that's really weak is going to dock itself on the receptor of the breast cancer, estrogen positive breast cancer. And it's going to prevent the bigger, more damaging estradiol to dock onto that receptor. So that's how it works to be really beneficial. So soy is not bad. You just got to get the right soy. You need to eat it kind of like the Asians do of getting fermented tempeh, things like that. Good quality tofu, and make sure it's organic and non-GMO. Number 3 biggest myth, and this is a really interesting one. It might be like, whoa, holy cow, are you serious? That the only way to prevent breast cancer is doing a mammogram. I'm sure you guys have heard that, right? And what's crazy about it is in the cancer world, they call it preventative medicine. That is preventative medicine in breast cancer. You get a mammogram. You start getting at age 40. They've decreased the age. It used to be 50. Now it's at age 40. You start getting a mammogram every year, especially if you're at risk. And that's preventative. Actually, that's just finding the breast cancer early. It's already formed and it's finding it early. And also there's research that mammogram could possibly cause breast cancer. We're seeing that mammogram, you are able to identify cancer earlier, but we are also seeing a greater incidence of breast cancer in people that are doing mammograms. We have research out of Europe and there, especially in Switzerland, showing this. So no, the only thing you can do is not get a mammogram. It's not even preventative at all. There's a lot of other things you could do. If we're just talking about imaging, a safer way to do this is you could start doing what's called a thermogram. This is just looking at heat signatures on your body. When the heat changes based on cancer, your metabolism changes when you get cancer, and it changes the heat sensor in that specific area. And a thermogram is able to pick that up, and it's able to pick it up really early before even a mass shows. So this is a really safe way that's not going to give you any radiation, and it's a great option too if you really want to see something to do some imaging to try to see if a cancer is forming. But also, like I just talked about, diet is huge. Eating good quality soy is huge. Making sure you take care of your mental, emotional well-being. That's probably the biggest one out of it all. Majority, 95% of my patients at least have something psychological going on. They had some really stressful event. They had a bad marriage. They had someone die in their family, or they were not sleeping very well. They had work, whatever. All kinds of emotional events that could be going on. They're depressed, anxious, all these type of things. That's are some things that we need to do and work on to help prevent breast cancer. It's not getting a mammogram. Don't feel safe if you're just getting a mammogram that you're not going to get breast cancer, because that's just not truthful. Number 4, the greatest myth regarding breast cancer is that the only treatments that you can do that are effective on treating breast cancer is chemotherapy, radiation, and surgery. Those are your only options. And I'm sure you've heard that from other oncologists. You come in, you get a chemotherapy protocol, a radiation protocol, or some surgery, maybe some immunological drug. That's less common, but maybe you got something like that. And then they don't talk about any of the other therapies that are out there. We already talked about dietary protocols to do that. That's beneficial. But we have all kinds of other therapies. If you probably have been watching my podcast, you've heard of high-dose IV vitamin C, or you've heard of mistletoe therapy. You've heard of alpha lipoic acid and turmeric and boswellia, and on and on and on. And these have a lot of research on them, not just doctors seeing benefit. There's actually research articles being done on here. We have white papers on this looking at these therapies being beneficial. But doctors continue to say that these therapies are not effective, and the only therapies you should be doing are chemotherapy and radiation. And that's just wild in my mind that that's the only thing that you do is just that, because there's so many other therapies. I'm not saying that you don't necessarily do these therapies, because they might be the best thing for your cancer, but there's so many other things that you could add on that are going to hit the cancer from a different angle and boost your immune system, or prevents growth of mechanisms, or many other mechanisms of action that the chemotherapy might not be specifically working on, or the radiation, etc. Number 5 biggest myth regarding breast cancer is there are no alternative therapies that are effective on treating breast cancer, or otherwise, it's actually going to make your therapies not work very well. So if you do alternative therapies, it's going to make the chemo not work, the radiation not work, or the immunotherapy not work. Now, there is some truth to this. There are certain herbs that you take that can decrease the effect of chemotherapy, but putting it in a realm that all therapies are going to actually make chemotherapy worse or radiation worse is just not truthful at all. In my practice, I actually give a lot of alternative therapeutics when my patients are going to go on chemotherapy or radiation that are going to help improve the effectiveness of those therapies and also decrease the side effect profile of those therapies. I'm always telling my patients, okay, yeah, chemotherapy, radiation might be best for your cancer, but I would never do that alone, because you're going to miss out on all the other effects that are going to happen with all these other therapies that we could add on board. We could decrease the side effects, like we could keep your immune system strong. We keep your red blood cells up. We could decrease the mucositis, the brain fog, the fatigue, or all these other symptoms that could go along with these therapies, with what we're doing. And we actually could improve the outcomes that come. So you feel better and you could improve with the outcomes. So the thought that medical oncologists are saying, don't do any other therapies with these therapies, with the therapies they do, is really decreasing the effect that they have. So I hope they broaden up their minds and start looking at the research and start actually being like, wait, there are a lot of other therapies that we can use. We could talk about diet and fasting. We could talk about all these other nutrients that we could take. We just need to look at the research. It's not about all these therapies are bad. Let's look at the real research behind how we can improve chemotherapy, radiation. And I hope this will happen in the future. If you want to learn more about the best foods for breast cancer, click my video to the right. I'm Dr. Jake, and I'll see you there.